Hi, I'm Dr. Mike Zachek, and I've been at the Gilbert Clinic since 1986. If you think about it, there's only two ways to get air into the lungs, through the nose and through the mouth, and if we keep both those passageways clear, then it's pretty obvious that the snoring problem will be lessened. From the top down, if we keep the nasal passages clear by going to the grocery store and doing some simple things like using saline nasal spray, saltwater nasal spray before bedtime, removing the mucus from the nose, that might open the nasal passages some. Many patients have allergies. This is Kentucky after all, so sneezing, itchy eyes, nasal congestion can lead to more snoring, just as a person who has a cold might snore more as well. Fixing that with a nasal steroid spray, they're available over the counter, something like Flonase or Nasacort would be ideal. Sometimes people use an antihistamine in conjunction with that if their allergies are particularly bad. People don't typically use the nasal steroids every day. They use them when they've had exposures like cutting the grass or working in the yard. Additionally, we can use some mechanical devices to open the nose, things like breathe right strips, or they make little plastic nasal dilators that go inside the nose. And if folks would fiddle around with those nasal sprays and the mechanical devices that hold the nasal passages open, they might be pleasantly surprised that it's greatly reduced their snoring. Now, the other reason that people snore is body position. When doctors learn CPR classes, we're taught tilt the head back and pull the jaw forward and get the tongue out of the back of the throat, keeping the airway clear. Now, if you think about it, when you're laying on your back to sleep at night, just the opposite happens, and the chin tends to drop back and the tongue blocks the back of the throat. So we ask people to not sleep on their back, to try to sleep on their tummy or their side, just because it keeps the airway open. If folks do those simple things and snoring hasn't been eliminated, or especially if folks have problems with snoring where the airway gets completely blocked, or maybe there's actually a pause in the breathing, that's sleep apnea, and that probably needs to be addressed with a consultation.